Hi guys, Dr. Rachel here, polite. Okay, so on to my next video. So as most of you know, I'm a chiropractor. I have always worked in health ever since I was 18. I started training as a nurse and then I went back to university and I studied as a chiropractor. Now, chiropractors work on the muscular neuro um, system. So we work on the nerves, muscles, joints, everything. So we work on the body. And what I found that I was doing initially as a chiropractor was just working on the mechanics. Okay, so I was working on the physical. So I was working on tight muscles. I was working on trapped nerves. I was working on stiff joints. Okay, which works. It's fantastic, except for a subset of people. And what I was finding, especially in chronic pain patients, but also in these patients that would come in with absolute tension in their jaw, tension in their neck, tension in their shoulders, their muscles literally felt like rocks, tight hamstrings, and whatever I did, it would just come straight back again. Okay. And especially with chronic pain patients, this is where they perceive pain very differently to a nice, healthy brain. And when they perceive that pain differently, there's no real cause for them to feel pain. So, as you know, or as I'm going to tell you, pain is a message from the brain to warn us about something, to warn us of injury. Now, once that injury has occurred, you will feel pain in order to protect, say you sprain your ankle, in order to protect that joint. But then as it heals, the pain should lessen. So with chronic pain patients, this message never ever goes away. Okay, so they're perceiving pain when there's no longer a physical cause. And so I was seeing this in so many of my patients. And I started then researching more, going into the brain based things and understanding the enigma of the brain. And why people, what can we do to improve my outcomes for these patients? And I have an absolute hyper focused brain. So when I find something interesting, I become very hyper focused, and I lived, breathed, studying this brain mainly to help me understand my own brain, to be honest. And then that allowed me to give a lot more to my patients and to get much better outcomes. So as a chiropractor, I treat the brain, but I also do treat the body. Going into certain parts of the brain, your emotional brain, which will control your fight, flight, freeze. And I used to see in so many people that this was constantly on. Life stresses means that the anxiety centers of their brain were overactive, mainly because their prefrontal cortex was, which was keeping a gate on this, was underactive. And that's due to chronic stress. And the world that we live in, unfortunately, is incredibly stressful. And so over time, these brains just became more and more unhealthy or inflexible. They weren't able to work in real time. They were working on um, they were working on things that they'd learned in the past, where the brain had become overwhelmed and dysfunctional. And so I researched probably for like 7 years, really trying to understand the brain. Um, and I then came across neurofeedback, which, although has been around for 30 years plus in infancy, is now really becoming the forefront of being accepted by the medical profession as the brain becoming vital in treating in order to treat our whole health. If you think about it, your brain controls everything. When you're in fight, flight, freeze, your immune system drops. Okay, so the fact that people were coming to me with these physical pains, um, which was just a sign of an underlying dysfunctional body and dysfunctional brain. And so I just found that by treating the brain and treating the body, we were able to reduce reduce these muscle tension. When you're in fight, flight, freeze, your flexors become tight, your jaw becomes tight, your hamstrings become tight. Um, your stomach becomes tight, so you can't breathe properly. So anxiety causes physical pain. Okay, you become hypersensitive to any sensation. So I would find a lot of people would be have hypochondria. So any kind of sensation that they felt, they become then hyper focused on it. And these are just all signs of a brain that is inflexible and unfit. And so the more I moved into the brain area, the more I realized that as well as treating physically, I really needed to treat the brain. And we do that through healthy brain practices like supplements, um, through training the brain through neurofeedback, but also teaching clients good healthy brain practices like mindfulness, like taking time out, like having strong boundaries against saying no. And then all of a sudden, I found that I could treat my patients holistically. So that is why I treat the brain and the body um, holistically in order to get much better outcomes from pain. Hope that makes sense, guys.